Thank you, Elaine. And on behalf of GE and the GE Foundation, I extend my welcome to all of you here today, county officials, Senator Fair, New Horizons members, as well as the members of the GE family. In 2009, the GE Foundation and Healthy Imagination, which I'm responsible for, launched a program we call Developing Health. It started out as a $25 million program for GE and the foundation to extend grants to health facilities across the country, those facilities who give access to care for those people who are underserved, either uninsured or the working poor who can't afford health insurance. Recently, because of the success of the program, we've expanded to be a $50 million program where we're going to continue to expand this program across the country. We recognize here in South Carolina, generally and specifically here in the Upstate area, about 19 or 20% of people are actually uninsured. And we know that those people who are underinsured or uninsured are less likely to get the screenings they need, to get the follow-up care that they need, and they tend to use emergency rooms and wait until they can't wait any longer to seek care. Through facilities like New Horizons that provides this care, provides a place for those people to go to get the very basic needs that they have, to help them manage their chronic illnesses, to help understand what can lead to prevention of cardiovascular disease and stroke and other debilitating diseases, provides an essential role in doing that, and that role cannot be understated, and we are so thrilled to be a part of and partnering with facilities like this here in the Upstate. This center here in Greer, the center here downtown, the center in Greer, and the center in Travelers Rest all received a $250,000 grant for their facility to help them expand the access of care for their communities. These grants and the partnership establish a new relationship for us. This isn't just us here presenting a check, that's nice, but we also want to become a partner. And so the team here at GE Energy will do skills-based volunteering. And what we mean by that is no matter the different kinds of things that can happen, one of the things I understand this morning the team came out and did a fabulous job of planting plants and getting the facility ready, but also those things that we can bring from a knowledge base. So as the facility is looking to expand into electronic medical records, we can have our IT division come and help and consult and help them with that. If they're looking to make sure the community knows what they're doing from a marketing perspective, we can have people that have understanding to come and help that. If it's about understanding patient flow and how they can, in fact, optimize things in the facility, we have a lot of manufacturing and Lean Six Sigma skills can help do that. So a variety of activities that the employees of the GE Energy facility here will do at each of the 3 facilities, and we feel that's as much a part of the program as any dollar amount that we might be able to contribute. So it's just a start for us. We look for this to be a lasting relationship, a true partnership. This is one of 12 sites across the country that we've done so far, and we have another 8 or 9 to go. And so we're again thrilled to be a part of this. We're thrilled to be down here today. And at this time, I'd like to invite Mrs. Mitchell, Regina Mitchell, up, and I will present her her check.
Obviously, you know who I am. I'm Regina Mitchell. I'm the Chief Executive Officer for your Community Health Center, New Horizon Family Health Services. Our mission is to improve the health of our communities by providing quality, affordable, patient-centered health care. Ms. Broderick has already acknowledged our dedicated board members, medical staff, other professional staff, and frontline staff that make that all possible. And we are so thankful for their support in advancing the mission. These are the people who make a difference in the lives of the more than 21,000 people that we serve each year. Today, I'm pleased to say we have even more for which to be thankful, and that is the generous gift of financial support from GE, as well as the GE volunteers with whom we will partner to address critical issues within our facilities and operations. With GE's assistance, we will work to improve our service delivery, not only at the individual level, but also at the broader level as it relates to community health priorities. Through our ongoing quality improvement programs, which includes input from consumers, we know that there are a number of activities and resources that we could put in place that would provide greater benefit to our patients. Unfortunately, due to the current environment, we, like other businesses, have struggled to function at an optimal level just due to economic constraints. So again, we are thankful GE has stepped up to fill the gaps and support our efforts to ensure better access for more people in our communities. Now, I'd like to use an analogy here just very briefly to make an extremely important point. Our goal at New Horizon Family Health Services is not to provide a luxury vehicle type experience. You know, the fans say, I don't have to name a particular model or make, but they have all the bells and whistles. However, we firmly believe that every citizen deserves something more than, you know, that old clunker, it leaks oil, you never know if you can depend on it from one trip to the other. That's not a desirable level of health care, because you cannot rely on it. It does not meet your needs. So to wrap up that analogy, the version of health care that we are working toward is something we feel that is more reasonable, realistic, and achievable. And if taking that to the car analogy, what we're talking about is something that is affordably priced, well constructed, and a reliable system that you know that you can count on, and it will be there when you need it. Now, in that context, I would like to just very briefly highlight several examples of the projects that the GE grant and volunteer assistance will allow us to implement in order to impact access, quality, and cost. We will put in place an enhanced chronic disease management program. This program will provide expanded care management and self-management tools for select, I have a little competition here, sorry, for select high-risk diabetic patients and other chronically ill patients. The program is designed to keep their illnesses under control, keep them healthy, out of the emergency room, and I know Mike Reardon from GHS, you'd appreciate that, keep them out of the emergency room and lower their overall cost of care, utilizing an evidence or science-based approach. We also plan to implement an evening pediatric dental service, particularly in one of the more rural areas of the county where access to dental care for young children is almost non-existent. We plan to further expand access to after-hours care by making evening medical appointments more available, language interpreting services, and health education classes at times that are more convenient for people who are working or attending school. And finally, one final example is a health and social support program for the fragile elderly. We find that many of our older patients are really encountering a lot of difficulties with keeping their appointments. They're ending up in the emergency room, and unfortunately there are times when there are hospitalizations that we know could have been avoided. And it's because they lack that basic social support, someone calling them, reminding them about taking their medications correctly. They may be embarrassed to say, you know, I really can't drive myself to the doctor's office. So we're going to put some extra support in place for those particular individuals. New Horizon is fortunate, as you've heard earlier, to have long enjoyed the benefits of productive partnerships with many other community-based organizations over the years. This has made our greatest progress to date possible. We will continue to reach out to existing partners and new partners to implement these projects and to sustain them going forward. Studies show people with regular access to primary medical care and preventive services are less likely to require hospital admissions, ER visits, or regimens of expensive medications, all contributors to escalating health care costs. So as for New Horizon Family Health Services, we remain committed to working with all of you to shift the focus from costly sick care to a system that focuses on health, wellness, and prevention that will positively impact not only individual health outcomes, but the health status of our entire community. Thank you.
My name is Monty Atwell. I have the honor and the privilege to be GE's city champion for the Developing Health Initiative here in Greenville. And you know, I have this script that I was going to cover, but as I sat there and I thought about it, you know, I don't have the check that Mike had. I can't reproduce the passion that Regina has, and I don't have the stories that the senator has. So I'm gonna cut right to the chase, and try not to be the be the dullest speaker as we finish this thing up today. As I say, you know, it's a great honor for me to be the city champion for this initiative. This is actually my second go-round at this. I was actually in Houston when we rolled that initiative out as the city champion, and it was an unbelievable experience for me personally to be able to you know, we in GE, we were very proud of the passion that we put into our jobs and the work that we do. But when you see the work that you folks do, it is it's a very humbling experience for us. So we hope to become a truly great partner here in the city of Greenville. There's a lot of great things we can accomplish together. I want to go through a little bit of some of the tactical elements of what we're going to be doing, how we roll this thing out. But before I do that, the first thing I'm going to do, you'll see a lot of people standing around in the purple shirts today. Our first venture in our volunteer efforts was this morning planting flowers and mulch, and I'd like everybody that was part of that to stand up and be recognized. Thank you very much. You know, as we go forward, you know, there will be lots of opportunity to do things like this, but as Mike said, one of the great opportunities for this initiative is to really share some of the skills and expertise that we bring. You know, we learn a lot as GE employees from all of these centers that we work with, but we also can help in many different ways. Everything from some of the things that I've seen helping with IT activities on digital medical records, where we've done everything from build the networks that run the systems, to load the software, to train the operators, to scan the records, to helping with financials, to canvassing neighborhoods, doing marketing. Lots of different things like that. Volunteer efforts that are as small as a single person taking a hold of an initiative and really driving it, to, you know, hundreds of people showing up for a Saturday event, cleaning up and helping out that way. So we have a lot of things in mind, and hopefully we'll get started very quickly here. What I'd like to do now is really kind of talk about how we're going to structure the program. We've got 3 centers that that Mike spoke about, and we align the center directors with the leadership in our affinity organizations. We're very proud of how diverse employee base that we have in GE, and we have a lot of groups that really you know, help cultivate the members, our diverse employees. Our Women's Network, our African American, Asian Pacific. We have lots of groups, and we're going to align these groups with these different centers and partnering them together and allow these employee groups to really get to know the centers as well.